My name is Butsi Tladi and my day job is with Alexander Forbes Health, but I'm also the chairperson of the FIA Health Exco.
Please comment for us on the Medical Schemes Amendment Bill.
So the Medical Schemes Amendment Bill is part of what is required, or the changes that are required in legislation to align to national health insurance. So if one accepts that NHI is the future, somehow there is a need to ensure that the framework that medical schemes operate in, it itself aligned to that. So key to that, obviously, it's if one accepts that the two-tiered health system that we have, that is the public health system and the private health system, somehow they have to work together. The two-tiered system is not sustainable because on the one hand, we've got this overburdened and under-resourced public sector, and on the other hand, although you access good quality care in the private sector, it is hugely unaffordable. Very few people are able to participate in that system. So somehow we do need a change. And the amendment bill is part of the changes that are required if we are to prepare ourselves for the future.
And apart from regulatory changes, what are the other catalysts you factor in when preparing for the future?
One looks at what people need to be able to access the care that they need at the right time, at the right facility, and at the right cost. It is quite it's a complex environment that we operate within, and it involves a number of stakeholders. And what one needs is all of these stakeholders to somehow begin to work together. We in many ways work in a fragmented environment, and one needs to come together. And some of the thinking that has come through in the health market inquiry that has just happened, and the recommendations that are coming out begin to address some of that. Begin to say, how do we ensure that some of the factors that have not worked, for example in health, you increase supply but prices are not coming down. Why is it that this market itself is not reacting to the normal competitive forces? Why is it that technology does not bring costs down in health? So all of those things one needs to take into account and ensure that how do we better reduce the inequalities that one finds in a society in issues such as health. Health is very emotional. All of us do get sick from time to time, and when we do, one would want to ensure that we access the care we need.